Hi everyone, we're back with sessions 57, and the topic for discussion is hydration versus dehydration. Topics will include an overview of hydration and dehydration, lost in the desert, a long plane flight and dehydration, DVT, which is deep vein thrombosis, burns, firefighting, and at the end we'll reference you to some other sessions that will be of great value to you after you've watched this video. So let's get started. First we're going to talk about what really is dehydration, what is hydration and what is dehydration. We're going to set the example before us of what hydrated fruit look like and when dehydrated fruits look like. Here we have some lovely plump and juicy grapes. Naturally, they're well hydrated, they're full of water, and then right next to them you have dehydrated grapes, which are raisins. They're dry or crinkly, they don't look as beautiful as the grapes. When the body is well hydrated, there is enough fluid on board. Because when you're dehydrated, there's loss of excessive body fluid, which may lead to dehydration. Even the skin turgor is affected. The skin turgor always looks very good, nice and elastic when you have enough fluid on board, but when you become dehydrated, skin turgor is really poor. Dehydration may be mild or severe and may be caused by many different conditions. We're not going to be able to go into every single condition that leads to dehydration, but I've tried to get some of the most common and appropriate ones. Electrolyte imbalances may result from dehydration, poor skin turgor, which I just discussed, muscle cramps, mental confusion. As you get more dehydrated, you lose the ability to think clearly, hypotension, because of lack of circulating volume of fluid, your blood pressure starts to go down. And all this may result from dehydration. Also, something called hypernatremia can result, which is sodium becomes very concentrated in the body for people who have sometimes loss of fluid, or the other way around. You might be hyponatremic if you've lost a lot of your sodium. Anyhow, let's first address what it feels like. Tim is lost in the desert. For over 24 hours, he has been wandering around trying to find a way out. He has no cell phone contact. He is short of food and water. Dehydration is starting to set in. He's weary, he's faint, and a little confused. And people do go walking around in desert places. Some people love to go on these nature walks. And the problem is sometimes they're not very well prepared. They didn't take enough food and drink. They just assume that they'll follow a path and everything's going to be fine. Sometimes it works out and sometimes it doesn't. Some people may not be very familiar with an area and find themselves in over their heads. Like this poor guy, he's lost, he's confused, now he's beginning to get a little delirious and hope for the best that somebody's going to find him. Obviously he did not prepare himself for what he might have to face. Next, we're going to discuss about when people fly. Many people fly. Some people fly short distances. You may go across the country. Sometimes it's just a mere 3 hours change. Some people just go from, just from east to west. It may just be 3 hours change. But what about when you fly from, let's say, United States to the Far East or so? Sometimes people lose as much as almost a day in time. They've gone through different time zones. They didn't hydrate themselves very well. Sometimes on a long flight when you're rushing to do plane changes and things, it just doesn't happen. You start out in the day, then suddenly you find yourself in a nighttime situation, and this can lead to dehydration. And the problem with dehydration, what can result also, is deep vein thrombosis, because the lack of fluid causes the blood to get very thick. There you can go to the clinical setting step by step, dearnurses.net, and find more helpful information on this topic. Now here's the doctor. This nurse works in the PACU and she's calling the doctor. She said that this patient is tachycardic and hypotensive. These are signs of dehydration. Blood pressure is 85 over 52. This patient just had surgery. What does the doctor suggest? Extra fluid, because the lack of fluid has caused a rise in the heart rate and a drop in blood pressure. Then let's talk about burn patients. Burns may lead to dehydration. And I've offered you the clinical setting step by step. Chapter 19 is packed with helpful information on burns. You can have, I know when it's just the first or second degree, that's very mild. But how about when it turns into third and fourth, when it goes all the way down to the bone and the skin is all parched? Gets a lot more difficult. And firefighters may also become, they are prone to dehydration. They sweat excessively. They work in a very, very hot environment. They have prolonged exposure to fire depending on how much time they're going to spend fighting it. And I was told by a firefighter several years ago they do something called pre-hydration. I don't have all the great details of how they stay hydrated, but one told me that he was a firefighter and they would do what was called pre-hydration. Prior to going into a fire, they would take lots of fluid so that they could go for quite a while without having to, reach out for a water bottle. Anyway, I hope you've learned something from this, and I'm going to offer you a couple of videos that will be of great help to you at dearnurses.com. One of them is Sessions 24, Electrolyte Imbalances, and I've told you that it's very significant because electrolyte imbalances do happen once you become dehydrated. And the second one is Sessions 30, Dehydration, What is it? And I hope you've learned something from this. Have a great day.